A very good afternoon and welcome to the session on the topic recurrent implantation failure. We are glad to have Dr. Ramya Mishra with us today to help us understand the topic in detail and with all the important details according to the topic. So, ma'am, you have the stage.
Thank you so much. So today we are going to speak about recurrent implantation failure. See, this is a very common topic. Previously, also I have spoken on the same topic, so most of us are aware of it. But this is for the new viewers who want to have an insight why we get a negative result in IVF, why there are implantation failures, or why sometimes we get a positive pregnancy report and then it goes out and we get a negative outcome then. So these things. First of all, before going into the details, I'll let you know what is recurrent implantation failure. See, there is no set definition, but whatever we have been we have seen is that we have heard is that if a patient who is less than 40 years of age and you have transferred around four good blastocysts or good quality embryos in three embryo transfer cycles, and still you get a negative outcome or a negative result, we usually label them as recurrent implantation failure. So we have another terminology called recurrent IVF failures. So recurrent IVF failures and recurrent implantation failures should not be confused. They are slightly different. Recurrent IVF failures is a broader terminology where you can have any reasons for that, any number of reasons for that, ranging from a poor embryo quality, ranging from a presence of hydrosalpinx or immunological factor or any other thing. But when you label a patient as a case of recurrent implantation failure, you have to make sure that yes, whatever embryos have been transferred in the previous cycles, they were of high quality, they were of good quality. The everything was nicely prepared, the endometrium was good, receptive, there was no hydrosalpinx or no other factor, and still the patient could not conceive. So, for me, it is important that whenever a patient who has got a history of recurrent failed IVF, I prefer ruling it out that whether they should be labeled as a case of recurrent implantation failure or not. See, during the sessions, if we have any questions coming up, we can answer them in the mid. As of now, I'm just going to tell you, if such kind of patient comes to you, what are the investigations or what are the tests we need to do. So whenever a patient with such a history comes to us, we prefer taking a detailed history from them, both from both the partners, from the husband and the wife, because whenever you treat a patient of infertility, it has to be a complete workup of both the sides, both the partners, right? So from the female point of view, we need to check out their egg reserve. How much is their egg reserve? As we all know that the egg reserve starts going down with their with the advancing age. So this has to be ruled out that they have got a good ovarian reserve in their body. So and what about their tubal status? That is also important. Is there any hydrosalpinx or any other pathology, or do they have any endometriotic features, or do they have any other like cystic structure in the ovaries? Anything, so you have to rule out first. Then you go to the uterine part. You check whether there the uterus, the lining is good or not, or there are any adhesions, or there is any septum, any fibroids, any polyps. Everything has to be ruled out. So once you rule out all these things, the female part is mostly done. But sometimes what we find out, that everything is fine right from the male parameters, like the semen analysis is also good, still the patient face the same kind of situations. So in these cases, you have to see if there is any DNA fragmentation in the semen, in the sperms or not, because that is also very important contributing factors for recurrent failures. So sometimes we get a normozoospermic report that everything is fine, the count is good, the motility is good, yet there is the patient is not able to conceive. So these are also important factors from the male point of view. One more aspect which is to be seen is the immune status of the female. Sometimes the immune status of the female is not wherever we want, so it rejects any kind of pregnancy which comes to the uterus. So they don't get implanted in their body, their own body starts killing the embryo is which has been put in the uterus. So antibodies testing have to be done. So this all aspects, once you check out all the aspects, then only we should label them as implantation failure after ruling out everything. We have.
Doctor, we have a couple of questions. I'll just, show you on the screen so that you can answer them.
Yes, yes, yes. Tanu has asked a question that fibroid can be a reason. Yes, Tanu, you are right. Fibroid can definitely be a reason because it hampers the implantation, of the embryo in the uterus. The embryo has to go deep inside the endometrium and get the blood supply from the mother. So when there is a fibroid, there is a difficulty for the embryo to go there and to implant there. So yes, it can be a reason for not getting pregnant. So before you before starting any IVF cycle, we definitely try to rule that out. That if the location of the fibroid is actually very important. So location is important. If you see that the fibroid is somewhere near the uterine cavity, or we call that submucosal, then you need to get rid of that. Otherwise, in a case of subserosal or a fibroid which is away from the uterine lining, usually we don't need to touch them or just forget about them, like that. We have another question, I go. Can low AMH value contribute to multiple failures? Yes, of course. Like I told you before, we label any patient as implantation failure, we need to rule these facts out that the embryos which were created from them were of good quality. So when once you have a low AMH, you have a low reserve, then the probability of getting a good quality embryo goes down. So this is to be ascertained before you start the procedure, because with a low reserve patient, you will get low number of eggs, you will get low number of good quality embryos, which usually we call as blastocyst. So yes, the chances of getting multiple failed IVFs is there, very much. Uh, any more questions? I cannot see much any questions here. Pinky has asked one question. My husband's semen is not good, and I had two failed IVF. What can be the reason? See, Pinky, it is like I told in the session initially in the session also that your husband semen has definitely to do with the quality of the embryos we get out of it. So if the semen sample is not good, there are chances that it may be a failed case. But yes, your doctor has to rule out any other factors which could be contributing to a failed case in your like your reserve is also equally important. So that also we have to give due importance before we start. You need to get some supplements in order to get a good embryo quality out of you. So you can check your reserve, you can ask your doctor to get in-depth analysis of your uterine cavity, you can go for a hysteroscopy. So after clearing out everything, you should proceed for the next cycle. Manisha Kashnyal has also a question. My elder sister is 42 years and no baby. She has had three failed IVF. What can be the reason? See, Manisha, we have done many sessions on low reserve or low AMH patients. So it is clearly indicated from studies that as you age, your AMH goes down, and so your egg reserve and the quality as well goes down. So this is important that your sister is 42 years and her AMH must definitely be down as the natural aging process happens. So failure of IVF previously three times, this could be the most common reason. The poor AMH, the poor egg quality could be a very common reason in these kind of patients. So these kind of patients have to see that yeah, you can go for either embryo pooling in a different, because if you low reserve, so you form less number of embryos, so you can go for pooling cycles, you can try. And if nothing works, then yes, last we can go for the option of getting for egg donation also. That can also help. Do we have any more questions here?
No, we don't have any more questions, Doctor. I think we are done with the questions.
Okay. So I'll just ask the viewers if you have any questions, or if you want to have any topic of your interest where you want to get information from us, you can definitely ping us. We'll be happy to take those questions, take those sessions, so that we can educate those who need, as far as the infertility is concerned, we can clear out their doubts. and we can keep catching up in the next coming sessions. Okay.
Thank you. Thank you, Doctor.
Thank you so much.